We're live on YouTube, live on Instagram. Hello, hello.
Hi, you guys. Dr. Jessie.
Dr. Cassidy.
We're with Chiro Moms. We're doing this on YouTube as well, so if you prefer to watch and subscribe, head there now. Paused due to poor connection.
See, now Instagram's paused. Oh, we're back. We're back. And
Okay.
that's where you can find it after this if you want to rewatch.
I never know where to look. We're going to just look back and forth. We are experts in prenatal postpartum care. We wrote the book on the mechanics of pregnancy postpartum care related to pain over a year ago. Research-based, took quite a bit of time, had to get board approval, blah, blah, blah. And now we get to start barfing it out. I'm just kidding. We've been barfing it out for 5 years. Which is why we wrote it, which is why we did this, because we're dealing with pregnant women, postpartum women every day, all day long, and we get to see trends that nobody else does. So we're here to talk about it.
What we share here, especially in the course, the timeline that we're going to go through. Today we're focusing on trimester 1. It's not going to be the timeline of pain that you see in a textbook. Pregnancy isn't a textbook kind of thing.
Definitely not.
Goes up and down. You can't even really research it. It's quite difficult, which is why there's a lack of research around it.
Yeah.
So we went with our trends with how we educate, and we're just going to start from the beginning. Try one, low back pain.
And we usually see this so much earlier than women ever suspect. So this was actually something that shocked me even with my own pregnancies. It's like generalized low back pain into early second try, like a lot of first try into early second try, because your relaxin, that beautiful hormone that makes all of this stuff wobbly to help deliver, it peaks at 12 weeks, which is the tail end of the first try. So it makes a lot of sense that you have a lot of low back pain in general across that low back, that first try. But nobody really thinks about it that way. So we actually, in the business that we do, we see a lot of patients end of the first try, early second, and they are coming in with generalized low back pain. And it is not due to a disc problem. It is not due to degenerative issues. It is not due to a trip and fall. It is general because the relaxin is basically allowing the pelvis to be hypermobile, and the muscles then have to overwork, and then they're putting excessive stress on the discs in your spine, and you're getting that general ache across the low back. It's lovely.
And relaxin, we talk about it a lot in here because it is such a big player. People are still doing the things that they think they should be able to do because they don't have a big belly yet, right? First try. But this hormone is wacky. It does way more than just make your pelvis wobbly. It will affect the space in between your cells. It will overproduce things and underproduce things throughout your pregnancy in order for you to carry babe. One thing that they used to think relaxin did, they thought it changed your structure of your bones. It does not change the structure of the bones, but it does make them more pliable to forces like bending. So then your body's able to adapt to all the changes necessary to grow and birth a human. So cool.
It's insane.
Insane.
It wakes up your protein.
Collagenase. If you say it quick enough, you won't even
don't
skip
like
over
saying the word. Anyway, it's basically activating that mechanism to, again, allow for your body to bend against the forces of what your body needs to do to house and hold that beautiful human.
Yes.
So again, playing into the stressors that your body can take at the start of pregnancy, throughout pregnancy, and again, that relaxin is one of the biggest components, especially with chiropractic care, because we're looking at the bone structure, we're looking at the mechanics, the joints, what they're actually doing, and that comes into the forces that play in. I kind of want to go right into, since we're talking relaxin, I want to talk about the muscles that play into the actual change that first try. So when you're peaking with relaxin end of 12 weeks, right? So it's actually 8 to 12 weeks is when it starts to peak. So it starts earlier than that, right? But then 8 to 12 weeks it peaks, and then it comes down a little bit and it tapers, and it sits in kind of a medium range the rest of your pregnancy while the other hormones are going crazy. But what happens I wish we
looking for a skeleton.
We're gonna pull a skeleton. But when you tilt like that, a couple of things happen. first of all, your center of gravity is already starting to change, which does bring me right into the stat with the 25%. So women who have the low back pain are 25% more likely to fall during their pregnancy, especially end of that first try when they're dealing with low back pain, because again, center of gravity is off and everything's already super wobbly because the relaxant has peaked. And then your pelvis is tilted like this, and you're getting excessive pull through these postural muscles that are usually holding you upright and keeping you from falling. So one thing that I think is super interesting that people don't often talk about is the ligamentous area in front of your actual spine. Let's see, I'm gonna actually grab.
Yes, so especially spinal ligaments, I feel like it wasn't touched on a ton unless we were talking like radiology and looking for pathology in school.
Yeah.
But we remember that we have ligaments running all along our spine that attach all of these front vertebrae. They go on the side. Of course, we have the back. But relaxin plays most into the front and the spinal side spinal ligaments along with the pelvis.
So that's allowing you, again, end of first try to do this. I feel like over here, do this. You really want to see my bum in that picture. This is a great angle, by the way.
Stand that way.
Maybe we're going to have to change the angle of the camera on the computer. I'm not sure. I mean, not today. We don't have to do it. We're going to do this again. But
Okay, great.
It's very low. We thought it's quite an angle. Yeah. But it allows you to do this, right? So normal spine, well, relatively normal. Here, we'll call that a normal spine. End of first try, first thing that starts to happen is you get the tilt and you're getting that stretch through the longitudinal ligaments on the front side. So playing into, again, the balance, the pain structure. So if you're not able to, again, use these postural muscles the way you normally would, guess what's going to overwork? This stuff. And when that stuff overworks, you get generalized low back pain. It's such a treat.
Yes. So if you maybe had, will you hand that one more time? If you've had low back pain in the past, it's not uncommon that those things are going to be more flared up or be a little bit easier triggered.
Yeah.
Because a lot of generalized low back pain in the common public is because of a weakened core. I hope you help me answer that because you probably had it drilled into your head in school. But this leads into the muscular stuff that we really hone in on with generalized low back pain, and that is your hip flexor, your lovely iliopsoas. Goes from your vertebrae of your low back and then wraps around to connect here, if you can tell. So it's pulling you forward when we tilt our pelvis, also trying to help rotate your leg outward. However, a few things happen because we have the shift here and shift out, right? Because we need a wider stance, wider balance. Yep, we're wobbly. That muscle gets real tight and angry, pulls even further on your anterior lumbar segments. Oh, look I even had a photo, I forgot. Oh.
It looks like this. So can you see this? Look at that beautiful psoas. It's a two-part. And when it does the things we're talking about, it shortens and it gets really tight. And then again, it can't aid in the postural help that it usually does when you're not dealing with this forward tilt. So again, just so you can see this beautiful muscle that Dr. Cassidy drew, she created this. Isn't that pretty?
Sometimes we get artsy in here.
Yeah, we do.
Well, most days.
Most days we're creating in here. But that when it gets shortened and tightened like that, that causes a lot of problems. So when it comes to what we do in here, we're looking at lengthening the tight stuff and anything that's sticking out one side more than another. So because you're extra wobbly, you're going to typically be using one side more than another based on your daily activities, and it's going to be emphasized because of that lack of normal postural base. So we're looking at adjusting the areas that are exceptionally tight because you may not know this, but the spinal segments right about here supply the information to your psoas. And then again, we're looking at contributing mobility through basically this part of your spine, L1 through L5. Our job is to basically lengthen the short stuff and create mobility in the tight stuff. And that's going to get you relief in your low back for that generalized low back pain through pregnancy. And then after that, we go over stretches, activation, anything that's going to serve you at home. And then we're also giving tools, like if it serves you to use an SI belt that's going to hold your pelvis so that your psoas doesn't have to be overworking, so that you're not dealing with as much of that forward tilt when you're doing things like walking, bending, twisting, lifting, laundry, dishes, whatever it is. So we're going to just show you a little bit of what we do.
Let's just do one side. Keep it
sweet.
short and sweet.
I want to say this too. Okay, so we made a reel this morning, and it was in regard to the things you don't expect when you're pregnant. The emotional component to all of this, it plays into this first component, which is low back pain. At the end of your first try, you're not ready for it. You don't know what's happening. You don't expect it, right? So you're frustrated. You feel like it's all over. You feel like this is what it's going to be for the rest of your pregnancy. You're in so much trouble because it's already bad. It's only going to get worse. It's the opposite, especially when you come in and see a chiropractor like us.
Yes.
But the truth is, we have a lot of women who experience a lot more low back pain early, and then it dissipates greatly at the end of their pregnancy. So keep that in mind. There are lots of tools, lots of things you can do, and there is hope. There is hope. And it's all about change. It's all about just reinventing what your daily life is going to be like as you progress through pregnancy and then motherhood, right? It's ever evolving. Life for me has changed greatly since having children. I am no longer a marathon runner, and instead I do a lot of Pilates and a lot of playing with my kids. Doesn't matter what that is. Sometimes it's jumping on the tram, sometimes it's playing soccer, sometimes it's catching a softball, which were not my sports growing up. Life changes and evolves, and you find different ways to do the physical stuff that you want to do, and you just keep rolling with it, right?
Your body needs to be adaptable.
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 We as humans are adaptable,
yes,
right?
Just like we want your pelvis to be in pregnancy. Okay, so as when we are working this, there's a lot of actually different ways to do it. This is how we like to do it because the women get relaxed in their back using a nice little wedge, and we can cue into their facial cues because this is one of those that they think if I'm white knuckling it, it's going to do more work. No. Little pain, okay, hurts so good kind of pain. We don't need a white knuckle. If you're clenching your jaw, too much pressure. What you're going to do is find the patient, pregnant lady, you'll have to sneak in between her growing belly and her hip, the lip of her pelvic rim, and apply pressure. I start with the knees bent so I can push my hands a little deeper. Then I'm going to ask Dr. Jessie to straighten the leg in which I'm working.
I'm not going to want to.
No. Ooh, yeah.
I know.
And I'm going to lighten up because she's giving me one of those, like, I'm really not going to make a face, but you want to.
Oh, it feels so good though after.
Yes.
It even sometimes tickles for patients. Like the tighter muscles get, in regard to what we do, usually it's because they're tighter. Or the more ticklish, what did I say? The more ticklish they become, or the tighter they are, the more ticklish they are. That's what I wanted to say.
Yes, I also noticed that.
They really get ticklish.
So those are some key things of what we do in here. It's super simple. We stick to I want to say prescription number, but we could sit there and do that for a half hour or stretch and lengthen through that one muscle, but we don't, so we just cap it 3 to 5.
Yeah. And it's the stuff you can do at home. So we're teaching patients to do some of this at home, and then we're teaching them how to do these stretches at home as well. So obviously that's passive care. That's what we're going to do in-house, right? In conjunction with the adjusting and the mobilization, which we'll get into more with another live. We're not going to have the time today, which is awesome. But we'll show more of the adjusting component with this or in regard to the low back pain at a different time. But we adjust, we mobilize, we lengthen the muscle tissue, and then we give patients an idea of what they can do at home. So for psoas, for low back pain, and again, this is so important because it starts on the front side, but attaches on the back side. So this is a big player in low back pain. Activation is just a lot of lifting and rotating outwards. So lifting, rotating outward. You can do it like
Left or straight leg,
Cassidy is. Yeah.
front leg.
It's just waking this stuff up, and then you go right into, and you'll find these stretches on our website and on our YouTube channel. They're everywhere. Let's see if I can get in frame here. But it's this one where you want to kind of tuck your pelvis forward, but then you're dipping into your pelvic floor. You hang on to something so that you're not working on the balance component, and then you just push and bring your torso back a little bit so you're lengthening through. Because of the rotation of that muscle, you have to kind of give it a twist to get that beautiful stretch through. But it's going to help with that generalized low back pain in conjunction with everything else that we're, advising you on.
So for our next slide, we will dive more into the true treatment, how we're adjusting and finding what to adjust, and just a little sneak peek. We'll show you the orthos we don't use.
We don't use.
We don't use orthos.
Did you hear that?
All students out there are probably screaming in their head like,
We don't do orthos. Not in pregnant women.
Not in pregnant women.
No, we don't.
Catch our next live and we'll dive into why.
Bye.
I didn't realize what time it was. I'm so sorry.